So I'm a nurse anesthetist, and I appreciate being on the EuroNurse podcast because I know one thing I'd like to talk about is kind of the similarities between nurse anesthesia and urology nursing. And that might seem totally like they're two totally separate sides of everything, but they're really not. What it's really about is about building almost instant rapport. And I really appreciate everything you guys do as a nurse because I want to have rapport with people so they trust me really with their lives. Anesthesia likes to say, we walk this fine line and, we hold people's lives in our hands. But the truth is that that does take a certain kind of trust. But I want to just say to you guys, it takes really kinds of trust to be a urology nurse. It takes people trusting you with, their issues with their sexual health and their urination health, extremely private matters. And I think it almost takes them to trust you more with these very personal issues than it does to trust me really with their life while they're undergoing anesthesia for their surgery and procedural care. So just want to say that. The second thing I want to say is I'm a nurse anesthetist. I approach anesthesia through a nursing paradigm. And that's really what I'll talk to a lot about in this lecture, and maybe even answer some questions for afterwards. So my foremothers really did create this profession, the profession of nurse anesthesia in the US, really the profession of anesthesia through the nursing framework. And one big thing that I'd like to do is talk about the nursing framework too within anesthesia. So when we talk about anesthesia, people say, well, what is anesthesia? And there's all kinds of definitions for it. But for me, anesthesia just comes down to these four things, which we call the 4 A's of anesthesia. And these are really what anesthesia really is. And it's really a balance between all 4 of these things. The first thing being anxiolysis or amnesia. So we call that the first A. And this is really, the medications that do this, I'll get into a little bit, but this is really the overall sedation, the taking care of anxiety. The next thing is very obvious, analgesia. And you can see those are at the 12 o'clock and the 6 o'clock position on my diagram, because those are really what most people think of for anesthesia. We want them to be relaxed, maybe even amnestic, depending on the depth of anesthesia and the nature of the procedure. But we really want them to be pain-free. And when we talk about patient comfort, and as a nurse, that's one of my primary things is patient comfort. I'm really looking at these two. These two are truly the pillars of anesthesia, anxiolysis/amnesia and analgesia. The other two that we see at 3 o'clock and at 9 o'clock on my diagram are autonomic stability and akinesia. Autonomic stability meaning that as people undergo these procedures, whether they're just anxiety producing or painful, we are going to trigger an autonomic response. And we might see that with high blood pressure or increased heart rate. We might see it as a low blood pressure or a low heart rate if we do vagal stimulation. But again, if we can kind of balance those first two, anxiolysis and analgesia, we tend to autonomic stability tends to take care of itself. The last one is akinesia, or meaning just we want a quiet surgical field. We often see movement under anesthesia, but a big thing to remember is that movement is actually reflexive, not conscious movement. So when we do anesthesia, it always, for me, comes back to controlling these 4 things: anxiolysis/amnesia, analgesia, autonomic stability, and akinesia.